Tonight, we're starting a special series about the future of work. It's clear robotics, automation, and globalization are driving big changes for workers and companies alike. Our team has been traveling the country to capture just who's benefiting and who's getting hurt. We begin in Appalachia, a region where good jobs have been in short supply and diversification is the name of the game. I recently went there to see how one community is dealing with life after coal. It's 7 o'clock on a quiet Tuesday evening in the mountains of eastern Kentucky, and Olivia Boyette, a second-year medical student, is studying at her kitchen table.
The main reason I sit here is so that I can see my white coat behind me and use it kind of as like, okay, you have to do this. Like one day I want that coat to be a long coat, and instead of just Olivia, I want it to say Dr. Boyette.
Her future may be in medicine, but for decades, her family and community were built around coal. Pikeville, Kentucky is a small city of 6,700 nestled deep in a river valley in the heart of rural Appalachia. As the coal industry declined, towns across the region struggled to survive. Since 2011, an estimated 13,000 coal jobs were lost here in eastern Kentucky alone. Some experts say to make up for the wages and the revenue lost in that time, it would take 30,000 new jobs today. Pikeville is now trying to fill some of that gap by shifting to healthcare and investing in its hospital system, serving 450,000 people across 3 states. It also employs 3,100 people, nearly half of Pikeville's population. Donovan Blackburn is the hospital CEO.
We have some of the sick of the sick when you talk about respiratory cancer, heart disease. But on the other side, we've got some of the best workforce, the best trained workforce that you'll find anywhere.
Training that future workforce, like Olivia Boyette, is where the local university comes in.
We have bright students here, and all they need is an opportunity.
Burton Webb is the president of the University of Pikeville.
One of the major purposes of being in a place like this is so that we can retain people who live here. They can train here, they can learn here, grow here, and then keep their families here. And it helps that we have an enormous hospital in town that's a regional medical center, and so there's a place for them to come and to practice and to live.
I don't just want to help people, I want to help my people. Pikeville, Kentucky and the surrounding areas is a very unhealthy area. There's a lot of tobacco, there's a lot of alcohol abuse, there's a lot of obesity. I feel like I want to give back to my community.
And the need here is dire. Life expectancy trails the national average by 7 years, and 70% of the hospital's patients rely on Medicare or Medicaid.
The amount of money that's paid to the federal government and to the state is very overwhelming, but the amount of money that's generated back into this community of allowing families to put food on their table, our average salary is around $65,000 a year. So we pay well, but overall the center has a huge economic impact to the region.
That impact is the initial return on millions of dollars invested from federal and regional loans and grants after years of planning by local leaders. City Manager Philip Ellswick.
We began to realize and accept the fact that coal wasn't coming back. And then the conversation changed to, well, what is going to be the future of Appalachia, the future of eastern Kentucky?
No more of the fatigue, none of the dizziness.
Born and raised in Pikeville, Dr. Chase Reynolds didn't think he had a future here.
In my mind, I was going to go to a big city someplace and practice medicine. I was very surprised as I started looking at job opportunities to see what had grown up in Pikeville, since I had left.
So these are going to be yours? Reynolds says the hospital's continued growth and investments, like this $30 million cardiac lab, have convinced him to stay. They've expanded to 340 patient beds, and there are now 100 open jobs. One of those jobs went to former coal miner Kevin Little. He started working in the mines at the age of 19.
Not everybody can crawl back inside of a mountain and go in and take out the middle of the mountain. You know what I'm saying? It takes a special kind of people to do that.
Kevin worked in the mines for 12 years. When he was laid off, he and his wife Misty say times got tough for their family of 4.
It wasn't the fact of not being able to buy everything that we was able to afford, but it was the fact of what if I don't find another job, or what if I find one that I can't take care of my family good enough with,
The job was gone, but our bills were still there. It was scary.
So you were already working in the hospital. When the chance came for your husband,
to come work with you. What did you think?
I thought it was going to be bad. I really thought it was going to be bad. I mean, he's a coal miner, you know, and then him working on patients and things, but he's definitely showed me different. I admire the person that he's become and the things he can do.
Kevin entered a year-long training program and worked his way up from operating room technician to surgical first assistant.
I think the Lord has blessed me so much to be able to have a job like I have now. I see a career now. As before, I had a job working in the coal mines, but now I see a career for myself.
The loss of thousands of coal jobs in just the past few years had a devastating effect across Appalachia. Pikeville thinks it has a plan for the future. The question is, can this work in other places?
Jesse Troyan of the Cardinal Institute worries that Pikeville, where 2/3 of the tax base comes from healthcare, is banking on an economic bubble that might burst.
When I hear numbers like that, I'm thinking that Pikeville has really capitalized on the Medicaid expansion type of dollars coming from the federal government. And should the political winds shift, does Pikeville have to, rewrite their story again?
But hospital CEO Blackburn says healthcare is just the first step towards a more diverse economy.
What we're doing is we're making smart investments in healthcare to create a healthy working community that has transferable skills while developing industrial parks to be able to invite industry in.
Smart investments in people like Olivia Boyette.
Have you had any double vision?
No.
Who's grabbing her chance to change her family's future.
I questioned myself. I was like, can I actually really, am I smart enough?
There must be a lot of pressure to be the first one on that road.
I don't want to let down, probably, other than my parents, my little sister. Sorry.
Why is that? Why do you think you might let her down?
Just because I grew up in an area where a lot of people didn't think that they could do, what they want to do. Especially, a girl, I want her to see that she can do what I do.
Has your little sister told you what she wants to do?
She says that she wants to do the same thing I did, and she wants to become a physician as well.
Just like her big sister.
Boyette is on track to graduate medical school in 2021. For the PBS NewsHour in Eastern Kentucky, I'm Amna Nawaz.
Our series, The Future of Work, continues all week. Tomorrow, John Yang reports on how changes in automation are especially impacting minority workers. Follow along with the entire series on our website, pbs.org/newshour.